Sisters, nyamine juma na she amawoze akodro. Say ye pastors will line dra. Thank you for joining us. Nyamin Sherwin. So breast cancer, when it affects one person within a family, all are affected. It's good that we all learn a little bit about this disease. Me Judith Abedu. Me a mammography technologist and also certified in breast ultrasound. I started doing mammograms in Ghana Kolibu Teaching Hospital. I've been in this field for a little bit. Me all kinds of things. Now along the line, hopefully I can share just a little bit. We're not going to go technical here. I just want to share a little bit of my experience in this field to hopefully help you, my sister or my pastor or my brother listening. Because according to statistics, 1 in every 8 women will be diagnosed in breast cancer, and then there is 1% of men who are diagnosed with breast cancer. What I tell folks is that breast cancer, it doesn't discriminate. It doesn't care whether you are the CEO of whatever or whether you are the one who cleans the floor. It doesn't care. What is breast cancer? This is a disease that is caused by abnormal cells growing out of control, and if this is not detected sooner and dealt with, it spreads. Ultimately, it can cause death. And they say, ijakiti be start as opposed to ijakesia or derko towards the ceiling. Which one is easier to quench? Definitely, we will all agree that kakraban is easy. Any fire extinguisher, you can quench that fire, as opposed to bibi or derikese. In the same way, if breast cancer is detected early, treatment is bound to be successful. I encourage us to take care of ourselves. In Besiafo, we are in the habit of taking care of everybody else, and we place ourselves last. What's the family like? We play a very vital role in our families. Let's take care of ourselves. According to the American Cancer Society, also women should start getting their mammograms from age 40 to 44. Also, it's recommended getting a mammogram, once a year. And then from 45 to 54, you continue to have that yearly mammograms. From 55 and up, and the recommendation is to have it every other year. So within 2 years, that's the recommendation. From my experience, get your mammograms every year. So long as you are healthy, sometimes will be baby someday. So when should I stop doing these mammograms? So long as you're healthy, and that, God forbid, if something is detected, you would want them to do something about it, go on and get your mammogram. Why not us? We are in a place where there are so many facilities all around us. And you have insurance that would cover. Any insurance, while there are avenues, call your local hospital and ask them, I want to have a mammogram done. I don't have insurance. There are programs there for women who cannot afford or don't have insurance. It's important. Then what? If you have a family member, a first degree family member who has been diagnosed with breast cancer, so let's say, for example, mother was diagnosed at age 40, then the daughters need to start their mammogram at age 30. 10 years sooner, you need to start doing your mammograms. I will encourage every woman to know what your normal breast looks like. One casa should be able to examine your breast. When you go for your physical, make sure that your doctor examines your breast. Their fingers are trained to do that. I will also encourage our men. Eyi paying seminary zo. Nti se hien papa no bi wo ma mpocho eyo yenye bresam. What should they more ye ho anyaman? Chware. Sometimes you can role play. You are the doctor, your wife is the patient. Use the padding of your fingers wahe ewa. Them padding jowo. One sana no one. And if very gently. Onu mpocho seri ya yi agendas ni fimo. Focus and do it. Nashe sa yen biara wonsa ka bibi unusual. Osimesi me nwode na deyo. Because I have had patients who have told me that their partners found a lump in their breast. Some of them have turned out to be benign, thank God. Some have turned out to be cancer. I will encourage brothers, our fathers, when you're doing your business in your bedroom, check your wife's breast. And if you find something, you say something. If you don't, thank God. At least that's one area you're capable of. And then besia one kasa, so check yourself. Check yourself. It's one say well, turn around, make sure that the skin area look funny. There's a picture here. Take a look at this picture and hopefully your breast never looks like that. Or you did see the little dimples or breast no. Or drew them stage na. Naturally the cancer chrono it's pulling on your skin. It's not a good thing. An extreme case of breast cancer. Ebe wode besia ne nipple or a pull into their breast was a nipple retraction. God forbid. I hope that we never have to see that. If you are checking your breast regularly, don't make it an obsession. Well, hey, no, don't do that. No way here. Eko doctor wa check say a spouse. Check it in the room, in your room. And then one kasaso. We always take care of others. We put ourselves last. Papa. Put yourself first. When you take care of yourself, then you can take care of others. On the airplane, what are them instructions now? Them oxygen mask, and what do they tell us? Put yours on first. Then you can help the other person, be it your family member or somebody sitting next to you who is disabled and can't help themselves. Put yours on first. There are a few risk factors. Some of them we can do something about, others we can't. One of the big ones is being born a woman and getting older. And look at our population. A lot of us fall into this group. But what's 1 in 8 women? Let's do our part. Another risk factor is just genetics. Breast cancer be of African descent or very aggressive. And unfortunately, even though we are not the highest group of women to be diagnosed with breast cancer or people of African descent, we are not the highest group. However, we are the highest group of women who tend to die from breast cancer. Na adza yebotum ya ye ho bibin yenye na breast cancer robotwe ubi nyinako. Whatever we can do, please let us do it. There's lifestyle changes or doctor's office. Every year me cover doctor's office. Judith, you need to drop this weight. I say, yes, I know. I'm working on it. I'm preaching to the choir here. Was the excessive weight gain can increase a person's chance of getting breast cancer. It's bankunet sewodna ne munkonkonte ni ginara high calories in the ban. Yere choche nama ye show. Both fruits, sweet bad nazi. You know, when we get it, we enjoy. I'm speaking for myself here. I say, any fields ban, it's not one thing when name I enjoy. Yen cut down a bit on these things. Because like anything else, also when we cut down on our weight, we reduce the chances of. Obesity, tame smoking, it's a risk factor, or you are increasing your risk factor in tea. If anybody, you know anyone who does that, encourage them. Chado, you're affecting many other things in your body, but you're increasing your chances if you smoke. Another risk factor is drinking heavily. You know, all the things are a doctor's office are work at all of them. They would either increase it or decrease it depending on what action you take. The things that we can control, it's not always easy. Particularly, it's not always easy. But when we decide we are going to do it, we can do it. Let us do it. Now you reduce your chances. After all, we want to be around. Next year or 2 years, here a conference, we want to see each other's faces. Let us do the best we can. Now let's talk about the gold standard according to the American Cancer Society. It's a screening tool that is what is used to detect breast cancer at its early stages, and that is mammogram. Most of us, I believe, had mammograms in our lifetime. But for any of us who has not gotten there yet, this is what to expect. When you go in to get your mammogram done, there are a few things to keep in mind. When you get there, you'll be asked to take your top off, your bra. What I encourage folks to do is go in with a 2-piece outfit. Says skirts na top or pants na top, so that as your pants, you just have to take off your top and your bra. Now I'm more gown na she. Then you go for your exam. Sometimes when you get there, we have to ask your history. We want to know when you had your first period. It is important. For a woman who had their period very young, let's say 9 years old, when you're in a period, na okwa to menopause be at 50 something, almost to 60, your chances of getting breast cancer is higher than somebody who had their period later on and then had their menopause sooner. Also, what's the chances of breast cancer increases? Unfortunately, for a woman who has not birthed a child, this is all part of the studies. Why? All right, for a screening mammogram, when you go in, we have an idea what to expect. But for somebody who is going to go in for their first time, you go through all the questions. You are asked to change, and then X-ray room. The technologists like myself will take at least 2 pictures on each side of your breast, different positions. It is very important that you cooperate with the technologist. So, yedze breast yedze trazado. Ni ya compress e betit pi dem crofo ka hey kaya mammogram wo breast wo flatten to the pancake. Munia. So when you to the pancake, nedze for mammogram, edzo pancake besana akọ. Na so sereba na when you fi ojinejina dra. The man edze besana akọ. We don't have the ability to change the shape of your breast permanently. For that short amount of time now, when you are compressing, the moment you Na sɛ hɛn paddle releases your breast gets back to its shape. Inti sɛ esuro dɛ what's mo kwame nufo be mi ande pancake we don't have that power. We don't have those abilities to do that. Medi baby aran the man edze wadze beko. Imbesiafo bi wo ho a wo implants. Eba. So therefore the average woman only implants ne breast ne natural. Yeah, at least 2 pictures on each side. But for a woman who has implants, we're taking at least 4 pictures on each side of the breast. With implants, it will not rupture. We are trained to make sure that we get good images for the radiologist to interpret. We do not rupture people's implants. Inti se wobia mema wa comment today ye muntumenkeyadi no do it. Because on the contrary, implants and a social say enyi bi na redwene wode menkaya implanta. If you're asking for my opinion, or maybe I'm giving it without you asking, is it worth it? Because depending on what is in bag na was ashawenu fuman. Cancer so ye kitikita otumusuma. Inti get some good brass or jack a girl see up if that's the reason why you're going for it. Or sondo biya ke breast cancer when your breast cancer. Na breast na ye deformed, they want to bring it back. Medical reason for it. I'm not judging you, I'm just sharing my opinion. If you care to listen, onye necessary because it's more complicated nyama. Ekaya surgeon no can't with it. After every 10 years, you have to replace it all. And now we'll share 10 years with inflation. 10 years from now, who knows? Juma retire. Or what there's an answer sadia no why them boba. Otuatua wakoko. Ebosha na implanti osise sure day. Na enufu na nkasa a drop. Ne hinze no ye feel munuanom chwarege. I've worked in this field for a long time, so this is just my, let's say unsolicited advice I'm giving you. Please take it, or you could do whatever you want with this information. But implants, if you don't have it, when my patients ask me, I tell them it's not necessary, but it's up to you. It's your choice. Anyway, so let's move on with this screening. It's about 2 or 2 on each side. If this is your first time, echo. Now, when the doctor reads it, they could call you back for many reasons. Again, I tell my first-time patients that, or you're very likely that you would be called back because we don't have anything to compare your breast to. This is your first time, so that's your baseline. Into so banda wa fraud, come back for additional pictures. Mr. It doesn't mean that you have breast cancer. Men kafa wo reports in shene starts in Google in Yama. Google or you now so also. If you are concerned, I think that there are a lot of doctors in our midst. Reach out to somebody. If you want to talk to a technologist like me, my number is available. Reach out na young kasa so that you don't freak out. But please go back and get that additional imaging. This is a screening exam, and screening mammograms, and mostly it is us women who do it. There are few men who come in, but those are the men who've been either diagnosed with breast cancer in the past, or they have a very strong family history of breast cancer. They're doing that to make sure that if they are part of the 1%, it's seen sooner. Now let's talk about diagnostic mammograms. Diagnostic mammograms, you use the same equipment. The difference is that one, either somebody is feeling something in their breast, whether it's a man or a woman. That's a diagnostic. Another you screening mammogram area, and then the doctors call you back for additional imaging. That is considered a diagnostic mammogram. Again, if you need to come in for any of these, come and do it. If you're a man, you feel a lump in your breast, don't ignore it. Most lumps in a man's breast, particularly if it's right behind the nipple, generally speaking, it tends to be something benign, just extra breast tissue growing behind the nipple, or friend a gynecomastia. All right, Irianum, so let me think of some potential questions. Let me take some of the questions that my patients ask me. Obituary bisode, can the radiation I use for mammogram now can that cause breast cancer? The answer is no. Hospital BIA or use mammogram machine. We have physicists that will be testing Nazi. Na one mammogram. It's like a plane fit in New York or Michigan. Radiation or everywhere. Ejina wujaze ezo nyamaka she microwave. Here phone na yekita. Yɛde hyehyɛ here nkotokum ɔhyehyɛ here no thank God na say phones na ya akɛse nsi mmesiafo fa nhyɛ ne nyinaa radiation, how be it small, radiation we twa here ho ahyia. So let us not say, oh, I am afraid of the radiation, so I am not going to get my mammogram done. Well, guess what? The alternative is worse. In every situation, if the positives outweigh the negatives, we go with the positives. We're surrounded by radiation. Getting your mammogram will not cause you to get breast cancer. Another question that I get regularly, particularly from women who are coming in for the first time, is it painful? Well, it is uncomfortable. However, we're very different. And also depending on the time of your period cycle, you go in for your mammogram. That's important. If you're a woman of childbearing age, the advice is that if possible, schedule your appointment within 10 days of your period starting. Them timing, your hormones are going down into you are not as tender. But before our period, for some of us, and the breast becomes untouchable because you are in so much pain. Don't schedule your mammogram around that time if you can help it. Yes, it's uncomfortable, but it is not supposed to be painful. What's another question that I receive regularly? Say, how long should I do my mammogram? Obi boss, so I'm 75, I'm done. Really? Meanwhile, nipakuri, so what can them meaning 100 meters? And I used to be a sprinter. But what catch them meaning nipakuru the person will beat me flat. The person is fit. Say, oh, I'm not coming back, I'm 75. And I'm saying, what if something else grows in your breast? Because as we get older, our chances of getting breast cancer increases. As long as you are healthy and if anything is detected, you want something to be done, you should continue to get your mammograms. I think I said earlier that they are holding on to the workers. No one so obey a mammogram. I mean, when you get so up there, no why a challenge. Like, are you really going to do something about this if you should get breast cancer? So get your breast screening done as long as you have health, that you would want something to be done if breast cancer is detected. I hope that you have at least picked up on something or have been reminded of something in all of this. And with people of faith, and we cannot be anxious about this. But in everything, like Bible, with prayer and supplication, we make our requests known to God, so that the peace of God, which transcends all understanding, will guard our hearts, our minds in Christ Jesus. Nyamin pengu obande in your process. If breast cancer is detected, hopefully it's detected sooner, and there's a lot of help. Reach out to your loved ones. So let us reach out to each other, and we can support one another through the process. God forbid, if ever, any of us has to go through this. If you have any questions, I have a channel on YouTube. I might record a few videos, because people ask me questions, and I thought, let me record it and put it there for anybody who cares to look at it. And see, you can check that out. It's called Life Matters with Judith on YouTube. Go out and check it out, and perhaps some of your questions will be answered. Otherwise, you can send me an email or you can call me and we will talk further if you have any questions. Thank you so much, Impayinfo. Once again, thanks for the opportunity and God bless you.